Right, it's 9 o'clock. Good morning, good morning, good morning, good afternoon, good evening to everyone joining us around the world, and a very warm welcome to the European Regional Hub session of the global launch of the State of World Nursing Report. My name is Lincoln Gombeza, and I have the honor of serving as your co-moderator for this session alongside my colleague Andres Wan. And I'm sure Margrieta is joining us as well. I'm a practice educator, and I'm currently the European Regional Power Lead for the Challenges Committee as well. So today, as we mark the International Nurses Day, we are also unveiling the World Health Organization SoWN report. I'm sure some of you probably have seen this online. This is just more than a document. It is a blueprint for progress, a moment for advocacy, and a rallying call for action. So the theme that binds us together today here is to engage, to empower, and to act. And this session aims to just do that. So just by giving you the voice nurses across Europe and beyond. So we are joined by incredible panel speakers, each of whom brings a valuable insights and lived experience from the world of nursing, health policy, and youth leadership. Over the next hour, you'll be hearing from our experts, our leaders, the change makers who are committed to shaping a stronger and more equitable future for our profession. I invite you all to use the Q&A box actively throughout the session, and we'll do our best to incorporate your questions during the discussion segment. So now let's begin. I'm going to start with Margrieta Langins. To open our discussion, I'm honored to introduce Margrieta Langins, Nursing and Midwifery Policy Advisor at the World Health Organization Regional Office for Europe. Margrieta will provide us with a summary of the key findings from the SoWN report with a focus on the European context. Her work is pivotal in advancing nursing and midwifery policy across the region. We are grateful for her expertise. Welcome, Maggie. Over to you.
Thank you, Lincoln. Thank you, Andres. And thank you, everyone, for joining us today. It gives me great pleasure to speak to you on this important day that we're launching this very important report. I hope you can see my slides.
Yes, we can see them.
Yeah. So I think the most important message for the European region is that our focus is really on retention and recruitment, and the State of the World's Nursing Report that's been launched today really puts forward an agenda and an urgent call for this. For all of you, you should know that we are 6 regions that serve WHO, and this is the breakup just to emphasize that we are the largest region of all the regions that serve WHO. We are many, many countries, many time zones, many languages, but we have many common issues. And so I just wanted, before we talk about what those findings are from the State of the World's Nursing Report and why retention and recruitment of nurses is so important for our region, I wanted to highlight some of the findings of the European Health Report that was launched just at the end of the last year. Most importantly, our population is the oldest population of all the regions, and we have hit a point where our older people of 65 and older surpass the number of people below 15 years of age. Now, that wouldn't be a problem in itself, but we have a significant number of people relying on long-term care. And this becomes, therefore, very complicated for our region. Moreover, the report has shown that 50% of people with severe self-care difficulties in our region are not getting the help that they need. On the other end of the spectrum, 76,000 children in our region are not reaching their 5th birthday. And we have a 21-fold difference in our region. So it is not the case that we are a bunch of very developed countries and that we are doing what we can to take care of those children. But there's a lot of variation in our region and within our countries that is not allowing these children to reach their 5th birthday. And one of those challenges in our region is vaccination, which falls in very much into the control and power of nurses. And unfortunately, we have not seen our target coverages of 95% reached in our region for diphtheria, tetanus, pertussis, measles, and pneumococcal conjugate vaccines. So this is very challenging. The obesity rate in our region nearly affects 25% of adults, and our mental health crisis is growing, with girls being generally affected worse than boys and experiencing a high level of violence in their lifetime, but boys being 4 times and men being 4 times more affected than women by suicide. We also have a high usage of alcohol and tobacco use, which is resulting in 1 in 6 people in our region dying before the age of 70 from one of 4 major non-communicable diseases. On the other hand, we have a quality of care issue in our region. And here on the graph, you will see the different conditions and diseases and how poor quality and non-utilization of services is affecting deaths in our region or in the world. So 60% of conditions and deaths are due to poor quality of care. So what we want to emphasize here is that not only is it poor quality of care, but unsafe care is actually leading to 1 in 10 deaths and disability globally. 1 in every 10 patients is harmed when they receive hospital care, and as many as 4 in 10 patients are harmed in primary and outpatient care. And this is resulting in not only deaths, but it's a huge cost to our health systems, resulting to up to 13% of health spending, where patients are not receiving care in time or at all, or they're receiving duplicate care. Or they're receiving dangerous care. So we as nurses are key to improving the access to quality and timeliness of this care by personalizing care, by expanding opportunities for prevention and opportunities for assessment and management, by connecting care, by coordinating the many different health professionals and the different sectors that are relevant for our patients, and securing care, making sure that we're not making those mistakes that have led to increased quality of care gap, but also that we are making sure our patients understand the sort of care that they're receiving. So the launch today is from 1 to 2:30. So please use this QR code to register for the launch of the State of the World's Nursing Report. Now, it is the second, and the first was instrumental to setting forward the strategic directions for nursing and midwifery in the globe. But we at the European region also had our roadmap for which we've been working for the past year. Now, what does the new State of the World's Nursing Report tell us? Well, for our region, we have seen an increase by 2% of the number of nursing graduates. But unfortunately, we have seen a reduction from 2.8 to 2.3 in the proportion of 15-year-olds who want to become a nurse. We've also seen that IT professions are more attractive for 15-year-olds than for health professions. When it comes to service delivery, we have seen an 8% increase in the density of nurses, but this density is not evenly distributed between the region, between countries, but also between different parts of the country. So rural care remains underserviced by our nurses. We also know that different countries have different arrangements and numbers of other health workers that can support nurses' work. And so it doesn't just, it's not enough just to have an increase in the density of nurses, but if we don't have a good a combination of physicians and physiotherapists and social workers and psychiatrists working with us, this makes the work for nurses very difficult. We've also seen that we also continue to see that our workforce is largely women. So 85% in the globe, but also 85% in our region are women. And that's obviously not a problem in itself, but it does mean that we may not be capitalizing on opportunities to attract men into this workforce. We're perhaps feminizing this kind of work and making it inaccessible to them. But we also have to consider that in our unequal societies, that perhaps there are a lot of pressures on women who are working in this sector that need to be considered when we think about their working conditions. We also have an aging health workforce in our region. Our doctors are aging a little bit more than our nurses, but our region is very diverse, again, in terms of aging. And some of our countries are actually experiencing really high rates of aging nurses, whilst others are having really young nurses. And so we need to think about both sides of those of the age spectrum for our nurses, to think about how we can retain and mentor our nurses that are coming in, whilst also maximizing on what our older nurses can provide and offer our health systems. Our region, you will see in the report, is the region relying most heavily on foreign trained nurses. This, for me, is an indicator that we are perhaps not retaining our nurses, our locally trained nurses as well. It's not good for the countries from which they come. It also means that those source countries where nurses are coming from into our region are perhaps not getting the adequate working conditions. But it also means that we need to think about how do we support those foreign trained nurses when they do come, because they will have different needs. And we need to make sure that at least they stay in the nursing profession and they do not go to other professions or lower skilled work because of a lack of satisfaction in the profession. Some good news is going to come out of the report. We've seen an increase in advanced practice, and us in the European region, we are a leader in advanced practice for nurses, but this requires a continued attention in how we are researching advanced practice, how leadership is supporting those advanced practice roles to actually be used and are regulated properly in the region. And I do think that in our region, we need to think about what people are understanding as advanced practice. So this publication, and you can scan the QR code, gives us a good sense of what is advanced practice. It's a master's educated nurse with advanced permissions to work in the system and improve patient outcomes. And my eye in our region is really focused on making sure that when we have advanced practice nurses, they are really being absorbed effectively into the system. When it comes to leadership, our region does excel, and it's greatly due to a wonderful group of government chief nursing officers that we've also been working very closely with in our region. And here is a QR code to scan our publication to show just how important government chief nurses are on the regulation of working conditions and regulation of education when they are in place. Our report showed just how important they are in linking up with other health professionals, with nursing organizations, with regulators, with different sectors, and with the areas of patient safety. We have seen an increase since 2022 in the number of government chief nursing officers, thanks to that work, but also thanks to our ability as WHO to really support them in their capacity to deliver on those improved working conditions, education for their nurses, and patient outcomes. This is important because actually we have a gender equality crisis in our region and all over the world. So whilst nurses are 85% women, women only occupy 30% of leadership positions. And that is something that I want to call everyone's attention to at this webinar. We see advocacy organizations, we see research, we see policy making positions, and we see clinical leadership positions more often occupied by men than by women. And I think we need to think about why that is. We also, unfortunately, see a a 24% pay gap amongst our health and care workforce, that we're going to be assessing that in the European region, what it means and what it means for nurses specifically. But basically, we are seeing nurses and doctors who are equally educated put forward men with higher wages than women. In the WHO European region, I want to call your attention not only to the State of the World's Nursing Report and all the work we're doing in the Global Strategic Directions for Nursing and Midwifery, which we hope to renew at the World Health Assembly next week. But I also want to draw your attention to this framework for action on health and care workforce, which really frames and steers our work in the European region. At the heart of it is retention and recruitment. And we say retention before we say recruitment, because what's very important here is that we create the conditions for those new recruits to thrive. We want to improve working conditions, safeguard health and well-being, and ensure policies that address gender inequality. And that is my commitment to the next few years in this European region. That is why we have the nursing action. We're working with several nursing stakeholders, including European Nursing Students Associations, who are represented here today, the European Forum for National Nursing and Midwifery Associations, EFNMA, EFN, the European Federation of Nurses Associations, and EPSU, the European Federation of Public Service Unions. So we're working with all those partners and DG Santé at the European Union with 19 countries to really strengthen working conditions and retention. And here is one of the examples that we just closed the largest survey ever in the EU that looks at mental health and well-being, and that will be integrated into the nursing action as we move forward with retention and recruitment strategies. So as we move forward, let's really think of ourselves as nurses. Let's think of let's take it upon ourselves as nurses to improve care, to improve equity among us and for our patients, and to ultimately move towards resilience and recovery. Thank you.
Oh, wow. Thank you so much, Maggie. Excellent. Thank you for setting the scene and highlighting, the opportunities and challenges ahead, for Europe. That was a powerful start to our conversation. I can see there is some questions, but I think we will moderate the questions when Andres take over later in the session. Thank you very much once again, Maggie, for a great speech. So we now turn to our lived experience panel, where we'll hear directly from those who are, both leading and living the realities of nursing today. So our first speaker really is Francesco Ferres, President of the European Nursing and Student Association. Francesco will share insights from the student nursing community and reflect on how the SoWN report can drive progress in education and leadership pathways. Francesco, over to you.
Thank you for the present to let me start. So I will share my slides. Can you see it?
Yes, we can see it.
Okay. So now in the big screen, right? Okay. So hi everyone. Good morning. First of all, happy International Nurses Day. And secondly, I want to thank Nursing Now Challenge and Andres for this invitation. I'm truly honored to join you today as the president of the European Nursing Students Association and as a part of a growing, energized movement of young nurses and students who are ready not just to inherit this profession, but also to shape its future. This year's theme, Our Nurses, Our Future, Caring for Nurses Strengthens Health Systems and Economies, is far more than a slogan. It's a powerful reminder that when we support and invest in nurses, we unlock healthier people, stronger systems, and more resilient communities. And that begins with listening to what nurses, and nursing students are really experiencing in the ground. The 2025 ICN Prayer Report gives us that honest look, and what it shows is both deeply concerning and incredibly motivating. We are seeing a sustained global shortage of nurses, one made worse by increasing attrition. 42% of national nursing associations report that more nurses are leaving the profession than in previous years. In some regions, the loss is described as significant or even extreme. Why? Well, the report is really clear. 61% of nurses report moderate to extreme job strain that doubles the average of other sectors. Over 40% say that they have insufficient time to provide quality care, and perhaps most concerning, more than 86% of nurses say they have experienced violence or abuse from patients or the public. Nearly 70% have faced it from colleagues or management. These are not isolated moments. This is what happens in the ground with nurses and nursing students. They are systematic signals, warning lights on the dashboard of global healthcare. And they tell us what while nurses have always been the backbone of health systems, they are too often being asked to carry more than is humanly possible. But here is what gives me hope, what fills me with pride, and we are not because we are not passive in these moments. We are being active. We are organized, we are loud, and we are being heard. At ENSA, we never believed in waiting for change to come from above. We believe that it starts with us. And that's why we are full partners in the European Nursing Action Initiative, an initiative to retention and recruitment of nurses and nursing students, working alongside WHO, Europe, DG Santé, and other major stakeholders to bring students and early decision making. Together, we are advocating for better working conditions, improved education funding, and policies that protect nurses and nursing students' rights and well-being, not just in the theory, but in the practice. We are also investing in leadership development through projects like our research masterclass, where students across Europe learn to engage with evidence-based practice, publish research, and shape the future of nursing through science and scholarship. We know that research isn't just something that happens later in the career, it's something that students should own from the start. And because nurses can't care for others if we don't care for ourselves, tonight we are hosting a special webinar on nurse well-being. We will be talking openly about mental health, support systems, and sustainable practice. Because burnout is not a badge of honor, it's a signal that change is needed, and we are responding to that call. Looking ahead, I'm especially excited to invite you all to our upcoming student symposium at the ICN Congress on the 10th of June, under the banner Empowering Students to the Future. This event will be a celebration of student energy, innovation, and leadership. It's a space where we will share best practices, elevate youth voices, and ask bold questions about how can we create systems that not only train nurses, but value, protect, and sustain them. Because the truth is, in ENSA, we believe that students and nuclear nurses are not just the future of the profession, we are already part of its present. We are the ones bringing fresh ideas into patient care. We are the ones pushing for digital transformation, and we are the ones refusing to accept a culture of burnout as normal. To every nursing student listening today, your contribution matters, your presence matters, and your potential is exactly what this profession needs. So let's be the generation that turned this moment of crisis into a turning point. Let's be the generation that ensures nurses are not just seen, but truly supported. And let's be the generation that makes nursing safer, smarter, and more sustainable. So thank you once more for this opportunity to share some insights, and happy International Nurses Day for everyone on behalf of the European Nursing Students Association. Thank you.
Wow, excellent. Thank you, Francisco, for reminding us, of the power and the promise of the next generation of nurses. I myself, I spend quite a lot of time with students. So, please do share some links in the chat, for your webinar that you are having today. And ultimately, I think your reflections on leadership development were truly inspiring. So thank you, thank you, thank you. I can see we are, happy. Yes, yes. Happy International Nurses Day to all. I'm seeing people from Oman, Nigeria, Sudan. Thank you for joining us. Next, I want to welcome Andrea Gonzalez, a Euro Region member for the Nursing Now Challenge. Andrea will speak to the importance of governance and leadership and the need to invest in nursing and midwifery to strengthen our healthcare system. Andrea, over to you.
Can you see my screen?
Yes, we can see your screen.
Okay. So, hello everyone, I'm Andrea and member of the Nursing Now Challenge Committee in the European region, as Lincoln said. And first of all, I would like to thank the organizers to give me the opportunity to be here participating with this amazing panel. I joined the Nursing Now Challenge last year as an early career nurse, and I have already had a lot of experiences. Through this year, I had the opportunity to take courses, attend webinars, and connect with incredible nurses around the world. I was especially inspired by meeting leaders like Aisha and Andres, whose passion and commitment reminded me that we can have a real impact as nurses, and not only in clinical settings, but also in the future of healthcare systems. What I would highlight would be how I have strengthened my understanding of leadership. I learned a lot, and I have also seen that nurses everywhere are stepping up, using their voices to advocate for change and showing the world the real power of our profession. Being part of this community has been so empowering, and I hope I will be part for it for a long time. One of the most important milestones in recent years has been the publication of the World's Nursing Report. And this document that was published in 2020 and is just updated today, don't just describe the current situation. Along with the strategic directions for nursing and midwifery, provided a roadmap for improvement. These documents highlighted the urgent need for better working conditions, more investment in nursing education, and the most relevant topic for me, greater representation of nurses in decision-making spaces. This leads me to another point, the essential role of chief nurse officers, an element that influences and that the advancing of our profession. Having these positions filled, but not only filled, with recognized position, ensure that nurses' voices are heard and considered at the highest levels of health policy and planning. And I want to take this moment to thank the World Health Organization for leading this effort and for their continued commitment to strengthening our profession globally. To talk about Spain, in Spain we are making progress in the right direction. We have now a representative in the health ministry, which is a great improvement. However, she doesn't have her own budget and is not in the organization chart, so she doesn't have independent responsibilities and autonomy. This is just an example of how we have still a long way to go. But because what we need is not only representation, but effective leadership. We need nurses with authority and resources to act. We need to move from symbolic inclusion to real influence. And we need systems that recognize nursing as a strategic pillar of health policy, not just a support service. But I think we are in the right direction. Why? Because I see the energy, the commitment, and vision of so many nurses around here. And I see new and old generations standing up for their profession. I see international collaboration, and I see initiatives like the Nursing Now Challenge building bridges. Let's continue to support nursing profession and keep pushing forward, because with unity, vision, and determination, we can, and I'm sure we will, build the future that nursing deserves. Thank you and happy International Nurses Day.
Thank you, thank you, thank you very much, Andrea. For that presentation. How you're emphasizing how critical governance, long-term investment in supporting nurses to lead and innovate. It is a timely message and it is essential. So thank you. I can just have a look here in the comment section. Andreas, if you don't mind, can you please share a link for people or for students who are in this session to join the Nursing Now Challenge? You are missing out if you haven't joined the Nursing Now Challenge. So please do share that link in the chat box. Thanks once again, Andrea, for that presentation. I want to now follow. I know, yes, thank you. Thank you. Nice presentation. You're getting good comments there, good feedback. So keep the message coming. Any questions, please just leave them in the chat. Yeah, I want to go to Christopher. Yeah, Christopher Hagen. Sorry if I didn't pronounce your name properly. Is representing the European region on the ICN-CCN Alliance. Christopher will discuss the report's value as an advocacy tool and how it can be used to engage with policymakers in a meaningful change. Over to you, Christopher.
Thank you so much. Can you hear me fine?
Yes, I can hear you.
Perfect. I just had some issues with my sound. But good morning, everyone. As you said, my name is Christopher. It's Christopher Andreas Haugen. And I am appointed by the Norwegian NNA to represent nursing students and early career nurses from Norway in the ICN Alliance of Student and Early Career Nurses. The Alliance, I don't know if everyone has heard of it, but it's quite new. It has just come together over the last few months, with the official launch coming up in Helsinki this June during the ICN Congress. And as an elected steering committee member representing the Euro region, I hope to see you all there. However, today I am speaking to you not just as a nursing student, but as part of the next generation of nurses who are stepping into a world in crisis and with a deep hope for change. As someone preparing to enter this profession, I have been watching closely the global conversation about the future of nursing. And one of the most powerful tools we have to guide that future is this second State of the World's Nursing report, which is being published by the World Health Organization. And I'm proud to say that ICN has been a big part of this report, contributing with major advocacy, leadership, and leadership. This report matters. It doesn't just tell us what we already know. It gives us the real data, real global robust nursing data contributed by over 190 countries. And that alone is a powerful achievement. But what it reveals is even more important. The State of the World's Nursing Report makes it very clear the world is still facing a nursing workforce crisis, despite progress in some areas. We're not seeing enough growth in the number of nurses. Working conditions in many places remain unacceptable, pay is too low, mental health support is lacking, nurses are often working in unsafe conditions, including in conflict zones, without the protection or recognition they deserve. And as a student, I see the impact this has on morale. I see the burnout in my mentors. I see talented students questioning whether they can afford to stay in nursing long-term. And I completely understand why. And personally, I've had the same thoughts myself. But this report does give me hope because it offers a roadmap. It shows where change is possible. It highlights advancements in leadership roles like chief nursing officers, more opportunities for graduate education, and steps toward gender equity in the profession. It gives policymakers a clear guide for action, and what we need now is the political will to follow it. The ICN has been a relentless voice in pushing for this report and in calling for a second edition, especially to reflect the enormous impact of COVID-19, climate change, and conflict on nurses everywhere. And the report is not just about counting nurses, it's about valuing them. It's about investing in their future and mine. From my perspective, this report is more than a report. It's an advocacy tool. It's our evidence when we ask governments to fund nursing education, improve working conditions, and support fair pay. It's our proof when we say nurses are central to achieving universal health coverage and improving health equity worldwide. But reports don't change the world. People do. And that's why I want to highlight the importance of the report as an advocacy tool to engage with decision makers, health leaders, and other advocates. The importance of investing in nurses, and not just with words, but with resources, policies, and respect. And to actually use this report as the roadmap it can be to drive change. The challenges we face are urgent, but so is the opportunity to shape a resilient, well-supported nursing workforce for the future. That future includes me and every nursing student who is ready to care, to lead, and to make a difference. If we're giving the support, attention, and investment we need to thrive. Thank you, and happy International Nurses Day.
Yes, thank you, Christopher. For highlighting the role of advocacy and engagement, with decision makers. So, and the strategic use of the SoWN report is clearly vital in policy spaces. So, thanks once again. I'm very conscious of time, and I want to move on swiftly. So now we're going to look at a country case study here, and it's going to be Ukraine here. We are going to shift, to just that national perspective. So it is my pleasure to introduce Paulina Gok, National Professional Officer for the Nursing and Midwifery at the World Health Organization Country Office in Ukraine. Paulina will provide a country-specific lens on how the SoWN findings can be practically applied to strengthen nursing in complex contexts. Paulina, welcome, and over to you.
Hey, hello everyone. So happy International Nurses Day. It's a big pleasure for me to be here, and I will introduce Ukraine and how we use state nursing report. Next slide, please. So why this discussion is matter? Because global reports provide a roadmap to strengthen nursing globally. Ukraine every time looking for and actively use state of the world nursing report and strategic directions for nursing and midwifery, for which we will discuss a bit later. We also developed our own national strategy for nurses guided by global frameworks. And these reports help us identify key areas, gaps, challenges, and priorities where the country have opportunity to develop. Next slide, please. So, State of the World Nursing Report outlines with the 4 areas of activity. The first one is education. As you know, everything is starting from here, from education and high quality of education. The second one is jobs, the third leadership and service delivery. But to be honest, it is very connected between each other. And in Ukraine, we see the same situation. Next slide, please. So here is the example how Ukraine has a progress of moving forward. For example, in education, we reviewed national nursing educational standards, which will align with all international requirements, including EU directive. Also, Ukraine is working very closely with collaboration centers. The next step is leadership. I am sure that every nurse is a leader in every country, the same as in Ukraine. Engaged in leadership development through the different programs. For example, WHO, ICN, and the Ministry of Health. And of course, it is too important to promote nurse leadership at all levels. That's why we're moving forward to service delivery and job. Nurses actively engaged in Ukraine in such areas as non-communicable diseases in primary healthcare level in different areas covering in primary healthcare level and also strengthen professional standards for practice. As for job, everybody needs to improve of quantity of employment of nurses and of course planning efforts for workforce planning and all other activities regarding nursing. Next slide, please. And the way we can move forward, so mainly it's continue using these global strategies to build a stronger and resilient nursing profession all over the world and of course in Ukraine. And our future goals include continued collaboration with international partners, elevating nursing leadership, investing in education, in high quality education, and of course in workforce quality. Our national strategy is built on these principles, and nurses are key to Ukraine's health future. I want to thank you to everyone and for every nurse, and happy International Nurses Day. Thank you.
Thank you very much, Paulina, for such a compelling and practical example of applying, the SoWN findings to real-world challenges. And thank you for, Ukraine's leadership is very, very commendable. Thank you. Yes, I am looking at everybody. You can see, Paulina, a lot of positive comments, a lot of hearts, emojis, and everything, So thank you once again, for taking time to come and speak to us. Let's continue with our spotlight in our country spotlight, with a contribution from Israel. I am pleased to welcome Marina Greenspan, content manager at the World Health Organization Collaborating Center for Leadership and Governance in Nursing, based within the Israeli Ministry of Health and Nursing Division. Marina brings a vital perspective on how leadership and governance are being strengthened through collaboration, particularly in one of the region's most dynamic healthcare system. Marina, over to you.
Thank you. Good morning, colleagues. On behalf of the WHO Collaborating Center for Leadership and Governance in Nursing in Israel, I am honored to join this important dialogue marking the launch of the SoWN 2025 report. At our Collaborating Center, we focus on strengthening nursing leadership and promoting policy-relevant knowledge exchange. Our work supports the development of strategic plans to build a strong future-ready nursing workforce. This is done under the guidance of Ms. Margrieta Langins, whose leadership has been instrumental in promoting collaboration and networking among chief nursing officers and WHO collaborating centers across the European region. Through regional consultation, technical cooperation, and leadership training, we aim to shape resilient nursing systems that can meet evolving population health needs. In Israel, and across the WHO European region, we continue to face critical nursing workforce challenges. This shortage is intensified by high workloads, burnout, and challenges in recruiting and retaining nurses. At the same time, in Israel, significant efforts are being invested in attracting new students to the nursing profession and increasing the proportion of advanced practice nurses. The SoWN 2025 report provides exactly the type of high-quality data we need to guide workforce planning. It reaffirms the urgency of investing in nursing education, improving working conditions, and strengthening leadership, 3 pillars of our own national strategy. Looking ahead, we hope future SoWN reports will include more region-specific data on advanced practice nursing to better reflect local progress and needs. Finally, we echo WHO call to action. Investing in nursing is key to strengthening health system, advancing equity, and ensuring access to safe, high-quality care. We are committed to using this report to advance national and regional reforms and to support nurses across our region. Thank you, and happy International Nurses Day.
Thank you, Marina, for your insights and the clear message about, robust governance and structured leadership development in building stronger healthcare systems. Just a great example of collaboration in action. So thank you once again for, taking your time to come and speak to us. Yes, yeah. Oh, the session is flowing. I'm really, really having a good time listening to all these amazing speakers. So our final country speaker is Dr. Martin Dugnan. Martin, please correct me because I think me and you we met in Copenhagen a couple weeks ago, where we had an amazing conversation around technology. So Martin is as a country advisor at the RCSI Global Innovation and Leadership Academy and part of the World Health Organization Collaborating Center for Nursing Regulation and Continuing Professional Development at the University of Medicine and Health Sciences, Royal College of Surgeons in Ireland. Dr. Dugnan will be sharing Ireland's experience with advancing nursing regulation and CPD, key enablers for workforce quality and sustainability. Martin, over to you.
Thank you very much, and thanks and greetings to you all from Dublin. It's a pleasure to speak to you today on behalf of the WHO Collaborating Centre on Nursing Regulation and Professional Development at the Faculty of Nursing and Midwifery at the Royal College of Surgeons in Ireland, and to be part of this important moment marking the launch of the State of the World's Nursing Report in 2025. And happy International Nurses Day to everybody online. I guess this report comes at a critical juncture. Across the 53 countries of the WHO European region and beyond, we face persistent health inequalities, economic pressures, and shifting geopolitical environment that threatens the stability of our health systems. And in that context, the value of data, of evidence, and of collective action cannot be overstated. I think one of the key messages that I want to share today is the central role of the WHO collaborating centres that we play in generating the evidence needed to inform nursing policy and decision making, both at national and regional levels. At the Royal College of Surgeons in Ireland, our centre supports the WHO in 3 interlinked areas. The first is strengthening nursing regulation. The second is advancing continuing professional development. And thirdly, building leadership capacity. And I think importantly, these are not just theoretical exercises. There are practical contributions by the Collaborating Centre to country reform, developed in direct response to technical assistance requests from member states. Through our country advisor, our researchers and institutional expertise, we support Margrieta Langins' office in particular in working with ministries and educators to address real leadership, regulatory and workforce challenges. Just as one practical example, we're proud to co-design the Early Career Leadership Programme in collaboration with colleagues from the International Council of Nursing, from FNMA and from the Early Career Nurses Association. This was developed as a pilot across the WHO European region, and the programme has been positively evaluated and really has already demonstrated value in building leadership pipelines among emerging nurse leaders. And I suppose we're at the stage now where funding has been sought for its broader rollout, an effort to really align strongly with the recommendations that we have seen in the report released this morning, and will be launched later today. We anticipate that the SoWN 2025 report will equip all of us, and that means policymakers, educators, regulators and collaborating centres with updated, validated data to inform action. As the global nursing workforce confronts rising attrition, geographic maldistribution, as Maggie alluded to, and burnout, there is increasing urgency to invest in nursing education, decent work, leadership and regulation. The last iteration of the SoWN report proved to be an invaluable tool, and we expect this edition will again provide the data, framing and momentum needed to advance our support to the WHO and to strengthen advocacy for nursing workforce investment. I suppose now more than ever, nursing WHO's leadership and the nurses within it, it is important that they are recognised and supported. At a time of economic retrenchment and declining public health investment, we anticipate that this report will serve as an essential evidence base and a shared reference point for us. As collaborating centres, we stand ready to use its findings to advance the case that universal health coverage, health system resilience, and equity cannot be achieved without nurses and nursing. We at RCSI are fully committed to supporting the WHO in the next phase of their work, translating data into policy and policy into action. Finally, we'd just like to say congratulations to the WHO, Dr. Kerry McCarthy in particular, and all the contributors from around the world who've made this report possible. Thank you for the invitation to present this morning on behalf of RCSI, and we look forward to the official launch of the report later today. Thank you very much.
Wow, excellent. Thank you, Martin, for that practical reflection on how, regulation and continuing professional development, go hand in hand with empowering nurses and elevating those standards of care. Your contributions, remind us that system thinking must be at the core of our strategy. So thank you once again, Martin. This is now the time you've been waiting for. I think this is a question and answer. So thank you to all of our speakers so far. We move on to the Q&A session. So please continue to post your questions in the chat box. So this segment will be led by my co-moderator, Andres. Andres, are you still available?
Yeah.
Andres is the European Regional Hub lead. He's my better half, my other half, so to say. So Andres, over to you with the Q&As, please. Thank you.
Can you hear me?
I can hear you, yes.
Okay, perfect. Well, many thanks. First of all, many thanks to all the speakers. I have been in the backside, but I have been listening to you all, and I must say that all the interventions have been very, very inspiring. I have been taking some notes. I have some questions that have been posted on the chat, in the private chat. So I would like to start with Francisco Ferraz. There's a question that's possible I would like to ask you to answer, and is, in what ways, I'm sorry, I have here, okay. What role does mentorship play in developing the next generation of nursing leaders, and what strategies can be implemented to foster their relationships according to your own experience in ENSA and in the university setting? Please go ahead.
So thank you for your question. Mentorship, honestly, it's right now we are facing, and last week we had a meeting about the nursing action in Brussels where we discussed as well mentorship, and this is a question, a really good question. What we are seeing about mentorship is that the degrees, and we are seeing a lack of trained nurses really to mentor. This leads, as you know, to for people to quit the profession. We see that in my country, in Portugal, we see this Europeanly and also globally. The mentorship process, I would say that is like when we are in the education and we are in our bachelor's degree, it's and when we go to the profession as an early career nurse, it's the mentorship process is what separates our motivation and what we see as the profession and what we face. So having a mentor that really supports us, that really guides us through our academic and then professional phase, we believe in ENSA that it's crucial for any nursing student. We will, and I can say that we have already hand over to WHO our technical brief about mentorship in this regard. Hopefully soon we will publish our main findings. But the idea is to strengthen, and the universities, the governments, the ministries of education really need to think on mentorship as a crucial tool to retain our nursing students and future nurses, because with only that we can evolve to the future. So I would say that keep an eye on our work, because we will publish
Okay.
our findings. Thank you.
Perfect. I have another question to Maggie, and then I will hand over to Lincoln again to the concluding remarks with Rita. Maggie, please, how can healthcare organizations and policymakers better support nurses who want to use the data of the State of World Nursing Report? And this same question, but focus on early career nurses.
So I think the aim of the State of the World's Nursing Report is to lead a data policy dialogue discussion. So, it's data dialogue policy discussion. So what we are asking organizations, whether you are a nursing or student organization or a nursing professional organization or a union, but also if you are an employer organization or a health service, is to look at the State of this World Nursing Report and come together through national leaders to discuss how you understand this data, how do you interpret this data for your respective responsibilities. We all have different responsibilities in this picture, and it's really important for us as organizations to understand and recognize that role. So professional organizations, I encourage you to stay to that professional science, right? That scientific representation of your organization. Unions, work on those developing that understanding of what the data means in terms of working conditions and employment conditions that need to be changed. Employers can bring to the table the discussion about what they need to support better working conditions and employment opportunities for their nurses. So understanding what our different roles and responsibilities of here is key. Engaging with the data, connecting with your national government chief nursing officer, encouraging your participation in national dialogues will be very important. This is the hope that we have with the State of the World's Nursing Report, and through those dialogues to identify policies. So not identifying only what we understand to be the data and having a common understanding of that data, but then also coming to an common understanding of the policies that need to be in place. And it's not enough, as our colleague from Norway said, to just have words. By Christopher said, it's not just about having strategies and words, but it's about implementing them. So recognizing our roles in understanding the data, coming to the table for the discussion of the data, and implementing the solutions that we agree together on. But we absolutely know there's just too much work to move forward, and there's no time for conflict and disagreement, but rather let's try to find ways forward amongst us nurses to implement the right solutions. So all hands on deck is, I guess, the final appeal.
Thank you very much, Maggie, for your response. Sorry, I'm very, very conscious of time. We are not done yet. So to close today's session, I'm pleased to welcome Professor Rita Suhonen, Nursing Now Challenge Associate and Professor of Nursing Science at the University of Turku, Finland. Rita will offer concluding reflections and powerful call to action as we look beyond the report towards implementation and advocacy. Rita, over to you.
Thank you. So I wish to express my gratitude to have the concluding remarks, and I want to wish you all the happy International Nurses Day. So we have heard today that Europe is having a kind of unique situations regarding to health, aging societies and long-term care needs, enormous needs, and the request for health is endless. And then at the same time, access in care is limited. At the moment, nurses are the biggest group of healthcare professionals, so this means that we have a power to change many things. The care of vulnerable groups is especially in the heart of nurses. But also, I think that nursing is about health promotion, so we need to recognize all the opportunities for prevention, not only to take care of those in health needs or illnesses, many illnesses, as we heard. What is a bit not concerning, but we need to take care of to optimize the domestic production, as the migration of nurses is a question today. Also is the gender equality, as we learned. So equity in access for services is the third one. So we need to be aware of all of these ethical issues we face more and more in healthcare sector. What we can do is that we invest, we build supply, and we do everything to retain and recruit new nurses, the future nurses. But for more than ever, the nurses are working in very demanding situations, and we are more and more speaking about the well-being and the working conditions. There is a need for better care, evidence-based practice and nursing care, and this requires continuing high-level education as well, not only the basic nursing education, but as well the continuing high-level education, and as well career development. APNs, advanced nursing practice, has been mentioned many times today. I think that research has some power to produce knowledge, and leadership is to support nursing profession and nurses that are working within this sector. But for the most, I think that for the future is the policy making, being heard and having connections. That is our duty, to build connections and talk about what nursing is. And this report that is launched today is highly important to understand the success, but also the needs and issues to be developed in the European region and more also in globally. So nurses are in front line to do this. So we know that nurses have power. So how to best use this power? We have strong statistics at the moment. We have plenty of knowledge. So let's use this information to safeguard and cherish our precious profession. And I have a pleasure, as I come from Finland, to welcome all of you to the ICN Congress in Helsinki in June. Once again, happy International Nurses Day, and thank you for all the speakers today and participants today.
Thank you, Rita. Invitation accepted. We will be making our way very soon. Thank you very much for your closing remarks. You know, a true call to action that we must carry forward today. I am very sorry. We are just very, very conscious of time. We've gone over by about 3 minutes. So on behalf of the European Regional Hub and Challenges Committee, thank you for joining us. Let's continue to engage, to empower, and to act as we shape the future of nursing together. Happy International Nurses Day, everyone. See you later. Thank you.